I'm Sherri Torjman with the Caledon Institute of Social Policy. It's no secret, most organizations in the voluntary sector operate on a shoestring budget. They typically lack resources to meet their needs, as you know, but despite this challenge, voluntary organizations have two great things going for them. They have their knowledge and they have their passion. Their knowledge about pressing social concerns derives from their interaction with the people affected by a given issue, and it also derives from understanding through evidence that we gather. And when it comes to social policy, good evidence is power. It's the most important weapon that we have in our war of words to win the hearts and minds of policymakers and of the general public. Because good evidence helps us understand the nature of a certain problem. It helps us understand whether we're making progress in achieving certain goals. It helps us formulate good, intelligent policy. So I wanted to provide you with an example of how good evidence can help us shape policy. Back in 1986, I was asked by the National Council of Welfare to produce the first national report on welfare in Canada. And it was no easy task. It was a real challenge. Why? Every province and territory uses a different rate. It was a hidden system. It was a complex system. Very, very difficult. But we finally put together a report. It was actually, we realized everybody uses a market basket approach, and every jurisdiction paid incomes that were below poverty levels. And we compiled our findings in a study called the Tangled Safety Net. And it made 55 recommendations for change, and for years, we talked about the need to increase welfare rates, both in their basic amounts and in indexation relative to the cost of living. And then in 1993, our policy world shifted, turned 180 on its head. Why? Because of some new data. And what happened that year? At Caledon, we were approached by the Ontario Fair Tax Commission, and they asked us to do a study on the interaction of the welfare system and the income tax system, and what would happen to welfare recipients who tried to go to work and have some earnings. There were no data available at the time. We examined 11 household types. We produced hundreds of graphs, and I got my first set of eyeglasses as a result of that work. It was really incredible. What we found was, in our view, absolutely astounding. We found that people who actually earned some income got to keep very little of it. For example, a single person who would increase their earnings by 1,200% ended up, at the end of the day, keeping about 25% in their increase in disposable income. Why? There was a welfare tax back, they paid income taxes, they had payroll contributions, they lost their refundable credits, they had a loss of income in kind, and we were really shocked about this. We produced our findings in a report called the Welfare Wall. Why? Because the graphs were coming off the printer, all of which had big bars looking like a prison. And we thought, it's a wall, it's really almost impossible to overcome this. And so we thought, is this the best policy route that we should be taking, where for years we had said, let's continually increase those rates? It really made us think entirely what we were talking about from a policy perspective. And we realized at the end of the day that perhaps in the long run, the more effective route to tackling poverty would be to actually dismantle welfare. It wasn't a popular solution at the time. Take it apart, piece by piece, and replace it with far more adequate programs of income support in this country that were federally supported. And that's where we talked about a national child benefit, to which Matthew made reference. We're proposing a national disability benefit for people with profound and long-term disabilities, severe disabilities, and the working poor, having some extra assistance for the working poor. So we had a completely different policy solution as a result of good evidence. Now, that's just one example of good evidence. As you know, in recent years, it's become far more difficult for voluntary organizations and our sector to access good data, because we had the dismantling of the long-form census in 2010. We had a number of associated surveys that count on the census as a gold standard. They disappeared as well. There were a range of other surveys and supports related to disability and welfare caseloads and social service spending that all disappeared. We had the dismantling of the National Council of Welfare. And what we've tried to do at the Caledon Institute, is bridge the gap and provide some gap, bridging between what we now have and what we need as a sector. And so we have a new initiative called the Canada Social Report. It's not a single report, actually, even though we call it that. It's a web-based portal. It's materials that will be updated on an ongoing basis. There's a vast range of information here, and I'll be talking about that in the discussion. There's no charge for this material because we don't want cost to be a barrier to anybody. Good evidence is the basis for the formulation of intelligent policy, as I said. And as a sector, as private foundations, you can come together and think about how you might support initiatives, this one, other ones, you know, anything that we're doing as a sector to try to help build our capacity to be able to create these intelligent policy solutions. Because at the end of the day, good evidence is the lifeblood of our sector. It forms the foundation of our knowledge, which in turn fuels deeply, deeply our passion. Thank you.